So good afternoon. Today we're going to give an update on the Commonwealth's contact tracing program, but first I want to share a quick update on testing and hospitalization. Yesterday we reported 6,300 new tests. That brings the total number of tests conducted in the Commonwealth to almost 340,000, which makes us the top 5 player on a per capita basis among the larger states here in the U.S. The positive test rate for this particular batch of tests was 28%. Now, over the past several days, this number has been trending down closer to 10 to 20%, so we're obviously going to take a close look at that data. But even with yesterday's data, less than 16% of tests over the past week have been positive, which is lower than at any point in April. And as we said before, our test results in many cases are an indication of where we test and who we test. And we do need to remember that that has a lot to do in some cases with the results. That's why we continue to expand testing, because we believe at the end of the day, the more we test, the more we know. And that's especially true when you test in places where you're particularly concerned about the populations that are involved, which is why we test in hotspots, why we set up a big program with community health centers across the Commonwealth, why we've been testing in healthcare facilities and long-term care facilities. And we continue, as I think everybody knows, to have daily conversations with the healthcare community to carefully monitor hospitalization rates and healthcare capacity. There are currently 3,564 patients that are hospitalized in Massachusetts due to COVID-19. This represents a small increase from the numbers reported on Tuesday, and it continues to be about 5% of the total cases here in Mass that are hospitalized. We're making progress here, but I want to remind everyone that we're still very much in the fight. Another way we're continuing to push back against the virus is to pursue additional personal protective equipment, or PPE. As of yesterday, we've distributed over 9 million pieces of PPE to hospitals, nursing homes, community health centers, cities and towns, and first responders in all corners of the Commonwealth. This includes gloves, gowns, masks, and ventilators. We know that people are obviously anxious to return to some sort of daily routine that made up the way we all lived before COVID-19 and the outbreak associated with that. And we're constantly talking to our healthcare leaders from across Massachusetts to monitor all of this data. The first step associated with reopening, where a limited number of businesses and activities can resume under new conditions, can't begin unless we see sustained downward trends in many of these healthcare indices. As you all know, the health data we're watching includes positive tests, hospitalization rates, ICU capacity, and of course, fatalities. Yesterday's numbers are evidence that despite some signs of trending in the right direction, we still have a lot of work to do when it comes to getting to the point where we feel like we have our hands and our arms around this virus. As we see the curve flatten, we can begin thinking about permitting some businesses to resume operations. And we want to reinforce that by increasing the importance of testing and contact tracing. We've talked a lot about testing. We've talked a little bit about tracing. And we thought it would be important today to talk specifically about how contact tracing works, what we've been up to, what our results are so far, and how we see the future with respect to this. And as we think about reopening the Commonwealth, there are many things we still need to do as part of our daily routines, like wearing a face covering in public when you can't maintain social distancing, washing your hands, and appreciating the hygiene issues associated with disinfecting surfaces frequently. And of course, we have and continue to increase our testing capacity, and we actively support someone when they test positive so that they can isolate and recover. But to bring the fight fully to the virus and get ahead of it, we also need to identify confirmed cases and the people they might have been exposed to, their so-called close contacts. And that's where contact tracing comes in. Contact tracing is a common public health tool that's used for diseases like measles, tuberculosis, Ebola, Zika, and now COVID. And it's usually done by local boards of health or by our State Department of Public Health or by nonprofit organizations in collaborations with governments, especially in developing countries. And for such a contagious disease like COVID-19, tracing is a critical part of how we take the battle to the virus. Last month, we set up the Massachusetts Community Tracing Collaborative. This group is a collaboration with local boards of health, the Department of Public Health, and Partners in Health, which is a nonprofit located here in Massachusetts to contain the spread of the disease. We were the first state in the nation to launch a statewide program in contact tracing, and we're fortunate to have the expertise of Partners in Health on board as we launch. The doctors supporting us have worked on fighting diseases like Ebola, and they've proven their model can work in places with far more challenging circumstances than we see here. We believe this tracing program will be a key element toward not only stopping the spread of COVID-19, but also toward understanding where the virus is, who's it's infected, and where, if we need to invest in hotspotting. If you test positive for COVID-19, you'll be contacted by the Community Tracing Collaborative or your local Board of Health. On that call, we want to be sure that you have what you need to isolate yourself while you recover. That might mean food if you haven't been to the store in a while, or other needs. We'll also ask you who you've been in close contact with for the previous couple of days before you started to have symptoms, or a couple of days before your positive test if you didn't have any symptoms. Then we need those people to pick up the phone. We want them to know why they should stay home, and we want to make sure they also have what they need to isolate and quarantine effectively. If you get a call or a text from your local Board of Health or from the MA COVID team, it's vital that you take that call. Doing so means you're helping your family, your friends, and your community, and the rest of us by reducing the spread of the virus. This call is your chance to fight back against COVID-19. So far, tens of thousands of Massachusetts residents have participated in contact tracing. To date, the Community Tracing Collaborative is connected with nearly 14,000 confirmed cases and reached out to more than 7,500 of their contacts since calls first started on April 12th. The Mass COVID team includes more than 1,600 people making calls. While more staff is anticipated, the team's working at nearly full speed, a remarkable accomplishment in barely a month since we announced this initiative. The median number of contacts reported by each confirmed case remains at about 2. This is a good sign that people are taking social distancing seriously, but that doesn't mean that folks can let up on the social distancing now.